Good afternoon, everybody. This is a remarkable day after many, many months of work together. It's great to have so many colleagues here that worked on this project together. And we know that through this last legislative session, we were able to put through a package for Connecticut, $30 million going towards lead remediation, which is such an important issue that has been facing children in the state of Connecticut for a long time. We know that the effects of lead occur particularly when children are developing, and the developmental delays and behavioral problems that can occur are long-lasting and very difficult to turn back. And so this investment by the state under the leadership of our representatives and our governor has been able to make an investment into the future of our children. So we have a group of people to talk to us today about the journey that it takes and the investment that this type of money will be able to make to be able to reduce the number of children that are actually affected by lead. Right now, we know that in a given town, for example, like Waterbury, there may be children, if you look at a level of, let's say, 20 micrograms per deciliter, maybe there were 3 children that would meet that cutoff. But we're going to be going down to a level over the next several years through 2025 of 3.5 micrograms per deciliter. And if you look at that level, we're looking at 252 children that would meet that cutoff. This is a preventable issue that is one that we can tackle and go away from, because we do not have paint that has lead in it anymore. This is a problem that's fixable and one that we can turn the tide on. And it is through the great work of people that are in this room that is actually allowing for public health to take the lead in this initiative. And we, as a Department of Public Health, are so excited to work with our partners of local health to be able to make this come through, and with our municipalities. So I'd like to first introduce the Alderman President of Waterbury, Paul Pernerowski.
Thank you all. It's great to be here today with all of you, to have the governor, our commissioner with us, our director of public health, Representative Stein. Welcome to Waterbury. And I'd like to say we also have with us today Fran Ford, who heads up our Healthy Homes program here in the city of Waterbury. Does such a great job with abating lead. And Alderman Mike Salvio is here with us as well today. So thank you, Michael. Today, as you all know, the governor is going to announce the enactment of the new statute that's going to strengthen our standards on childhood lead levels here and alleviate the risks associated with it, and also discuss the additional $30 million. As you know, childhood lead has catastrophic impacts on health and development of our children, and in cities like Waterbury, that is particularly devastating. The change that we're looking at in the legislation is going to so much more closely align our statutes here in Connecticut with the recommendations of the United States Center for Disease Control and Prevention and the American Academy of Pediatricians. And we applaud and thank Governor Lamont for his commitment, leadership, and investment in safeguarding the futures of children living in communities such as Waterbury, where lead exposure is most prevalent. Here in the city, our city departments have put forth great effort to assist families affected by lead paint, yet the need for lead remediation for Waterbury residences remains substantial. Nationally, 1 in every 5 children have high blood levels according to the Centers for Disease Control and Prevention. Out of 27,238 housing units in the city, almost 20,000, or 72%, were built before 1978, making the presence of lead either likely now or at some time in the past. Over the last few decades, the implementation of lead remediation and rehabilitation programs funded by federal, state, and private efforts have made considerable progress in addressing all of these problems. Waterbury was one of 4 cities to receive the highest possible grant awarded in 2020 for lead abatement in the amount of $5.7 million. The 3 other cities were Toledo, Ohio, Allentown, Pennsylvania, and Providence, Rhode Island. Since 2009, the Waterbury Lead and Healthy Homes has assisted 723 dwelling units with lead abatement. This legislation will enable health providers to more quickly identify children who are being negatively affected by lead, so that the home inspections are triggered and necessary remediation is made before the lead can have an even more detrimental effect. Landlords and property owners have a wealth of resources available to them for lead abatement through the City of Waterbury. Both the Community Development Block Grant and the Health Department's Healthy Homes programs offer funding and arrange for services for lead abatement in buildings. And just as an example, we have the photos on either side of me, which are 97 and 103 Tudor Street. In 2021, a little over $70,000 was invested in these two homes to remediate the lead and make them safe for children. Lead-painted exterior surfaces, as you can see, were enclosed with vinyl siding and aluminum coil. The leaded windows were replaced with energy-efficient vinyl windows. The interior surfaces where lead was found were encapsulated with liquid. The lead paint doors were replaced with fire-rated doors. The exterior stairs and porches were covered in commercial-grade vinyl, and the lead in the soil was addressed. So these are some of the examples of the sorts of work that can be done with the cooperation of the city, the state, the federal government, and all of our local folks, and the cooperation of the landlords. Mr. Bretcher is here today. He's the owner of 97 Tudor Street. And you can see the improvement it makes of the house, but most importantly, the improvement it makes in the lives of children and helping keep them safe. So we look forward to continuing our partnership. And again, thank you so much for all that you're doing in this endeavor, Governor.
Thank you for that overview and for the impact that you described. I'd like to now introduce Aisling McGucklin, the Waterbury Director of Public Health.
Thank you, Commissioner. I would first encourage everybody to just look around. Look at this beautiful mansion and consider the history that's in this building. Our city is a beauty. Around every corner is stunning architecture like this, remaining from the salad days of industry of Waterbury, when we were the home of several mills along the lush Naugatuck River and the brass mills that we're famous for. But hidden in a vintage treasure like this, Rose Hill Mansion, where we stand today, is an ever-present threat of lead dust generated every time someone opens a creaky old window or pulls shut a rough old door, wearing away at the layers of lead paint. These chips of lead flake off. They end up on the floor where children play, eat their lunches, and suck their thumbs. In our cities, as in most cities, the most vulnerable to this menace are families of color. Public Act 2249 and the ARPA funds mean that we might finally meet the need to address the cost-intensive work of lead education, remediation, prevention and abatement, and case management with adequate funds for the first time, informed by public health leadership. In Waterbury, our sanitarian, Josue Ortiz, manages the case lead management work and is helped by our Healthy Homes project led by Fran Ford. They know well the hard work it takes to work with families and property owners on this issue collaboratively. The silent nature of lead paint and other lead exposures make it easy to put off until later. But lead treatment needs to happen now, and lead abatement for the future needs to happen today. As a young, vibrant city, but a city with old housing stock, Waterbury has so much to gain from this infusion of funds and the opportunity to interrupt the cycle of lead poisoning. We're excited to use these funds for their proper use. We're trying to think innovatively in collaboration with the state task force and lead our city into a safer future for our children and our families, and particularly pregnant women who are also negatively affected. Thank you.
Our lead working group just kicked off this past Monday, and what an exciting day, where there were all these leaders who are doing work in the field, and you could see the excitement that people had to be able to bring this forward. So we are really looking forward to seeing how this progresses. I'd like to now introduce Simon Brescher, who has been involved in some of these remediations. Thank you.
I would like to take this opportunity to commend the governor and the mayor for making the Lead and Healthy Homes Initiative a priority in our city and state. And I encourage every single homeowner and landlord that have properties with children living in them to apply for this grant. From the the program led by Fran Ford and literally his A-team led by John, Carlos, and Lisa are superb. From the initial home assessment to the actual construction done on the properties, they're there along the way to answer any questions that anybody has, and they're really a true pleasure to deal with. You really want to act on this grant while it's still out there, because once it runs out, it's done. And lead poisoning is preventable, and you could and should apply for this grant before someone ends up testing positive. I personally have had many units go through this program, and I can tell you personally that the results are enormous. The tenants are happier, I'm happier, and everyone overall is happier. Obviously the priority is that children are living in a much healthier environment, and you're enhancing the property, the community that you live in. And I want to put it out there, if anyone has any questions about the program, feel free to call me personally. You can call the Healthy Homes program at the health department and ask for me, and I would be more than happy to share the results that I have found personally. So feel free. Thank you.
I'd like to now introduce Representative Jonathan Steinberg.
You heard Commissioner Gittani talk about how we've been working on this for many months. Many of us have been talking about lead poisoning for many years, in fact, a decade or more. We've known we've had a problem for some time. We've lacked the resources. And one of the important things about this initiative is not simply remediation, it's identification. We have to find the sources of lead. We know that homes of a certain age are likely to have lead paint. We also know that there are lead pipes throughout the state that need to be replaced as well. This is just the beginning of a much broader initiative to deal with one of the many infrastructure issues that Connecticut has. Thanks to federal funds and a governor who is committed to doing the right thing, we are addressing something that has plagued Connecticut for a long time, and most importantly, has plagued our children. The degree to which we can have an impact on their lives by interdicting lead at the earliest possible point will be transformative to many families. And I think it's really perhaps not a surprise that Waterbury is an example of Connecticut communities that face a lot of lead paint issues. But this is true in communities across the state. Many of the lovely homes that we admire, have to be very careful about remediating because they will expose us to other things. So this is the beginning. I'm very pleased to be part of the working group. I'm going to ride herd on this group right through the end of every last dollar that we can spend. This is definitely a public health issue. It's an environmental justice issue, particularly those it affects. And lastly, it's also an infrastructure issue, and we have to, at the risk of confusing elements, we have to strike while the iron is hot and take advantage of this opportunity. So I want to thank the governor, the commissioner, and all those who will be involved, particularly here in Waterbury, for the job we're about to embark on. Thank you.
Thank you. And now I'd like to introduce Governor Ned Lamont.
Yes, strike while the lead-free iron is hot. That's what we've got to do. And, Ainsley was talking about the history of this amazing city and this great state, and Jim and the YMCA here of Waterbury, thank you for hosting us in this amazing mansion, which I'm told dates back to 1850 when brass was king. And that's one of the pieces that makes Connecticut so unique, our history. And I wouldn't trade it for Tallahassee or Phoenix in a heartbeat. That said, as Paul pointed out, 72% of our structures here in Waterbury were built before we outlawed lead paint. It's probably 7.2% in Phoenix. So we have a little bit of work to do to keep ourselves safe and beautiful and respect our history. And that's what we're trying to do here today. it's, over the last couple of years, it's reminded me, Manisha, it's part of something bigger too. I mean, we found out during the, really the dog days of COVID, that COVID hit different populations in different ways. Ainsley referred to that. And a lot of folks, a lot of people of color, the racial disparities, those that had the pre-existing conditions, those that were more likely, for example, to live next to a highway where you had more particulates in the air, they had a higher incidence of asthma. Those that had higher incidence of asthma were much more likely to suffer the worst effects from COVID. And those are the investments we've got to make in an old state like this to keep everybody safe and make sure that none of these kids gets left behind, whatever zip code they live in, whatever highway they're next to, and whatever home they're living in. And that's what we're trying to do today. I mean, thankfully, going back to 1978, they outlawed lead paint, then they were on their way to outlawing lead and gasoline, but there's still an awful lot of structures out there with lead paint. And we've put in place the resources, A, to do the testing. So find out with your kid at an early age, with your pediatrician, make sure they're tested, make sure they're tested on a regular basis, make sure they're tested, especially if they come in a community where there's a lot of very, very old structures like this. Then we come out and we do the necessary testing right here in the facility to find out what we ought to do in terms of remediation. And we have the $30 million combined with a lot of HUD, which is federal HUD money, to make sure that landlord, make sure that homeowner, make sure that we can take care of you and you can take care of your family and your community going forward. I'd say what I read was about 80% of the lead-related poisoning is usually related to in and around the paint. Maybe 20% is likely to be in the pipes, the old lead pipes. You know, thanks to our federal delegation and president, we've got here in Connecticut over $100 million to start the long process of getting the last of those lead pipes out of our systems. So I think we're doing the right thing. You know, it's a long-term commitment we got to make here, but we're making it, and we're doing everything we can to keep our kids safe because we found out, during COVID, that we are all in this together, and if you're not safe, none of us are safe. Thanks, everybody.
Any on-topic questions for the group?
I saw that with the new blood level limits that would have, triggered an investigation follow-up. I saw that in the library in fiscal year 2021. There would have been like 1,000 cases that would have met those thresholds, but with the health department, with staffing, it would have been hard to do that. I'm wondering how you guys at the state level can help departments like library health.
So if you look at the actual change in levels, it's gradual over a period of time. And that was the reason that was done starting effective January 1st of 2023 and then going through to 2025. So that those levels go down gradually and so that the towns will be able to keep up a little bit more along with the infusion of funds that are coming. So that was the exact purpose of having that staggered change in levels so that by 2025, we'll be at the levels that we want to be at long-term to be able to sustain.
Questions? Thanks, everybody.
Thank you.